What's your name and title?
My name is Sophie Elliott. I'm the full-time speech pathologist here at LivinRite Home Health.
Okay, and why did you choose to become a speech pathologist?
So I actually became a speech pathologist after I watched my grandmother rehabilitate through a stroke, and there were lots of really intriguing components as far as PT and OT were concerned, but something about speech just stood out to me. It was interesting and unique, and so that's what drove my decision to choose speech pathology as my career path.
Okay, and how long have you been with LivinRite Home Health?
I've actually been with LivinRite since 2010, and I was here in various different capacities, but really transitioned into my role as a speech pathologist in 2016. And then in 2019, I joined the team full-time as our speech pathologist here at LivinRite.
All right, and what do you love most about working for LivinRite Home Health?
I really like the case management model that we've adopted, and it just really makes it seamless so that the patients feel like we're addressing them holistically. So if I go into the home and I have concerns that come up that are more nursing or more physical therapy related, I can really easily pick up the phone and call the office and reach one of my clinical colleagues that can help address those issues and answer questions so that the patients feel like their needs are being met right away rather than having to wait until the next time they see another one of those clinicians.
Okay, and what types of patients would you say you work with more frequently?
So a lot of our patient caseload is neurological in bases, so a lot of acute strokes or patients that have TIAs, transient ischemic attacks, but also some patients that have neurological disease processes that progress, so things like Huntington's disease, ALS, Parkinson's. I would also see a lot of those patients on my caseload as well.
Okay, and can you tell us a little bit about what you do for our patients in the home from a speech pathologist perspective?
Yeah, so speech is actually really kind of a misnomer for what we do. We do so much more than just speaking, although that is a large component of what we do, trying to help train patients to be able to express themselves effectively, whether that's finding the correct words that they need or actually being able to form the motor movements for speech production. But then a lot of our patient caseload is also based in swallowing disorders, so maybe patients that come out of the hospital with feeding tubes or just start having difficulty swallowing, maybe with medication changes. And then I also do work for some patients toward improving cognitive thinking skills, so things like memory, problem solving, safety awareness in the home, and that's generally in conjunction with PT and OT. And then sometimes we'll get the occasional patient who has a voice disorder, and working alongside the ENT, we would try to help address that in the home as well, whether that's someone coming out of surgery that was intubated or if there was another accident or injury that created the voice disorder.
Well, thank you so much for all you do for our patients, Sophie. You are phenomenal, and we appreciate all you do.
Thanks, Elise.
Thank you. Have a great one.
You too.
Thanks.